We are talking pubic symphysis pain, otherwise known as lightning crotch, or SPD, which stands for symphysis pubis dysfunction. It's this lower area, this disc between the two front crotch bones. This particular area has a set of muscles that attach directly into this area, and when they get tight, they can cause a lot of problems and pain during pregnancy. Here you'll see one of our doctors lengthening through this muscle tissue on a pregnant woman. Doing this, in addition to many different exercises and stretching scenarios, can make a huge difference for women experiencing this pain through pregnancy. Here you can see a pregnant woman stretching through these same muscles with the aid of a ball and pushing through to again lengthen this area. Now, in this particular video, she's activating these muscles, so making them wake up to then additionally stretch, getting an even better therapeutic effect. In this video, the patient is squeezing the ball with her legs and also activating through those adductor muscles, those same inner thigh muscles. That activation, again, wakes the muscles up, helps to kind of fatigue them so that you can then go and stretch them. Movement with the ball is also super beneficial, as you can see here. So you can do more than just holding, you can actually squeeze. In this video, you see the doctors lifting up and down. So on this particular exercise, they are activating through their glutes on the backside. Whenever we're working muscles or trying to tackle pain, it's really important to work both the front and back part of the body to keep things as even as possible. So in addition to activating the front thigh muscles, you also want to activate your glutes. Same thing here. You can see the patient lifting up through the glutes, activating those back butt muscles to then help counter everything that the patient is dealing on the front side. And in this video, she is laying on a wedge to make sure that she's not laying flat, because pregnant women really shouldn't lay flat for long periods of time. We usually have 1 minute being the rule of thumb for laying on their back. In this video, the doctors are demonstrating an exercise where they are activating up through their core and their glutes because they're squeezing that ball and their adductors. So this particular scenario, as long as it's not painful, is incredible for activating all those different areas. Now, here you can see the pregnant patient squatting. It's not a super wide squat, but it's a really good activation through those glutes, again, those counter muscles on the back, and even through that front side. Isolation on the ball is also very, very important. Here you can see the doctor demonstrating front and back isolation. In the next video, you're going to see the patient activating and isolating side to side. Whenever you're moving the pelvis like this and creating fluid movement through the joint space, you're naturally going to help decrease pain in that area, especially for pubic symphysis dysfunction. Now, in this video, the doctor is demonstrating a really great way to activate more of those glutes and that IT band, or the muscles on the outside of the thigh that we call the abductors, abductors. When you activate this area, again, you are counteracting the pain that you're dealing with on the front side and through that crotch bone pain. Here you can see the doctor stretching through that glute region in this particular setup. And now she's going to activate her adductors, which again are just those inner thigh muscles. This is a great way to get activation through those adductors. It doesn't take a lot of lift. You can just do 1 inch or 2, and you usually take it to fatigue. So you definitely want to make sure that it gets a little tired so that, again, you're activating, fatiguing, and then potentially stretching afterward to get a really global way of decreasing the pain and tension in that area. This is another great way to activate those adductors, those inner thigh muscles, pushing down on a Pilates ball. Again, it doesn't have to be a lot of motion. It can just be 1 inch, It can just be even kind of a forward rotation of the foot. It doesn't have to be a lot of movement to get the activation. Here, the doctor is going to use that same ball, and by stretching the body forward, so even with the belly, you can do this, you're getting a really beautiful stretch through those inner thigh muscles. And that is, again, a great way to lengthen through those muscles that are attached to the pubic symphysis. In this video, the patient is actually using a wedge to lean forward, and she's stretching through those adductors, those inner thigh muscles. Another great way to stretch through those front muscles that are attached to the pubic symphysis. It's really nice to have a tool to lean forward on so that you're not leaning forward too much or straining, especially if it's rather flared up. Here, the patient is going to demonstrate a proper way to get up. When you're dealing with pubic symphysis pain, you want to avoid shearing forces. So the same thing goes with getting up off the ground. Instead of getting up with one leg, you want to get up with two very evenly so you're not getting a pull through that pubic symphysis. Here, the doctor is demonstrating how the area would be adjusted. The doctor is looking for the high tight side and will mobilize, create movement through the pubic symphysis joint. Here you can see the adjustment from a different angle. Again, the doctor is looking to mobilize or create movement in that area of the joint space. One of the most important things you can do if the stretching and activation of the muscle tissue is not working exclusively is to wear an SI belt. So when you apply this belt, the key is to apply it very, very low around the hips, over the crotch bone on the front, and over the tailbone on the back, not high up on the belly. You want a belt that isn't too cumbersome and that really holds tightly through the joint space to decrease all of that shearing force and to give the patient a lot of relief.